Can bad backs really heal themselves? Can someone with a herniated disc really heal themselves? Now, many of you may know someone who has had low back pain due to a herniated disc who eventually led to surgery. However, what researchers find is that those who can actually ride out the pain for about 6 to 12 months, they find that when they do repeat MRIs, that sometimes the disc is fully resorbed, or the disc bulge, the disc herniation that was there before is no longer there. Now, how is this possible? Well, the current theory is that there must be certain molecular changes that happen due to maybe enzyme or proteins that explain why some herniated discs actually heal themselves and why others don't. So researchers at Vanderbilt University Medical Center have been researching this for some time, and they have recently published some interesting findings. So the way a disc herniates is when its outer fibers give way to the inner gelatinous material that's in the center. Now, some people use the term slip discs, and similar to your tires on your car, your discs have several layers, inner layers of ligaments which hold the material inside. So just like your tires don't necessarily just randomly slip off your car, your discs in your back are also pretty strong, just like those tires on your car. So it takes wear over time in order to actually cause herniations or significant trauma, not merely just a sneeze or a cough that would actually cause a disc to slip the way we envision it. When you look at a healthy disc here, you can see there's several layers to that nice healthy filling here, that jelly filling. But as it gets weaker, as these layers of ligaments break down, you actually get a bulge starting to form, and eventually it can break through and the outer fibers tend to give away, allowing some of that fluid in the middle to leak out. And if that material leaks out and hits a nerve, then typically it will result in pain like sciatic pain or leg pain, which we typically associate with a pinched nerve. So what researchers have found is that typically people with a herniated disc or this disc pain will eventually heal and pain will eventually go away. It may take weeks or even months, but the pain usually does subside. But the question is, why doesn't this happen with everyone? So looking specifically at the molecules that are associated with disc herniation, researchers have found a group of proteins called matrix metalloproteinase, or MMPs, which act like little Pac-Mans and eat away at some of that herniated disc material. In addition, when a disc herniates, it can bleed, and in that blood are white blood cells, specifically macrophages, which are immune cells in our blood that actually help reabsorb or ingest some of that herniated material. So the interesting thing in this research was that researchers found that not only just the MMPs and the macrophages and how they worked individually on that disc herniation, but how they actually worked together as well in a reproducible manner in which one could actually eat away at the disc herniation or the disc bulge. And what they commented on was the fact that rather than just like a bulldozer and getting rid of this disc herniation, these proteins, these enzymes, act more like surgical scissors going in and helping the body heal that herniated disc. Now, I've had thousands of patients with herniated discs come in and actually get relief quicker and help their body heal along the way so they can get that relief and get back to work as soon as possible. But many of them, when they first come in, are concerned that they'll need surgery once we make the diagnosis of a disc herniation. Or maybe they've already had the diagnosis made and they've been told they do need surgery, even though the pain may have just started a week or two ago. Since low back pain affects 60 to 80% of Americans, and with 300,000 low back surgeries annually for herniated discs alone, other resources should be sought if the surgery is not required. So the take-home message here is, unless you're having progressive neurological loss, meaning the loss of sensory or motor function, the ability to move, or specifically loss of bowel or bladder habit, inability to start or stop urination, there is no rush to run and have the surgery. As doctors of chiropractic, we offer natural, non-surgical solutions to help manage the pain while your body heals itself. So keep that in mind. If you know someone who's suffering with neck or back pain due to a disc bulge, the body can heal itself. And if a chiropractor can help manage those symptoms naturally, it's worth giving your body the chance at healing itself. I'm Dr. Pound, helping you heal better fast.